everyone. I am Dr. Vivek Venkatramani, consultant Uro-Oncologist and Robotic Surgeon in Mumbai. Welcome to the second part of our discussion on the impact of urologic cancers and their treatment on man's sexual health. As you can imagine, there is a lot of hesitancy and psychological barriers for the patient to discuss all this openly with their doctor. This is why it's important for the doctor to initiate the conversation to set realistic expectations and goals for the patient so that they are aware what they can expect after the surgery and the other treatments for their disease. Patients often hesitate to ask their doctors these important questions, and they are often unpleasantly surprised after the treatment about their sexual dysfunctions. Therefore, as a uro-oncologist, I always make it a point to speak to my patients about all these side effects and implications of the treatment that they might undergo. Some couples also need sexual counseling sessions after their treatment in order to maintain intimacy, and this is why I believe the pre-operative or pre-treatment counseling is also very important and crucial to raise their awareness about these issues. There are many treatment options available for erectile dysfunction after treatments for uro-oncologic cancers. The most common is the sildenafil or tadalafil tablets, which are PDE5 inhibitors which help with the man's erections. There is a regime known as penile rehabilitation, in which we prescribe these medications on a daily basis or alternate day in order to maintain the blood flow to the penis, and this allows for a better recovery after the surgery. There are also injections available which are injected with a tiny needle directly into the penis, which allow the man to achieve an erection in more than 90 to 95% of cases. Other therapies include vacuum erection device. Ultimately, if all these treatments don't work, there is the possibility of a penile prosthesis which would allow a man to achieve a normal erection later on. This is a fairly major procedure, but it has a very high success rate, and most men are very satisfied once the surgery has been done. So as we can see, urologic cancers as well as their treatments can have a significant impact on a man's sexual health and a couple's dynamics. Therefore, it's important to be aware of these issues, talk to your doctor openly before going through any procedure, and be ready to undertake whatever counseling and whatever treatment may be needed after the surgery itself. If you found this video informative, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.